Afternoon, and thank you for joining us for this community briefing on COVID-19. Joining me once again is interpreter Francis Beaubravage. Thank you so much, Francis, for providing your services and helping to make this briefing more accessible to those in our community. We encourage everyone to visit our website at covid19.lincoln.ne.gov. There you will find our dashboard with the latest COVID-19 data, and we update that dashboard at about 3 p.m. each day. You'll also find our COVID-19 risk dial, a color-coded tool that provides our residents with an understanding of the risk level of spread of COVID-19 in our community. And on the dial, red represents the highest risk of COVID-19 spread, while green represents the lowest. For each color, our health department team provides specific guidance on the steps that we can all take to protect the health of ourselves and everyone in the community. We update the COVID-19 risk dial every Friday, and the health department team has determined that the risk of COVID-19 spread in our community has increased. After 4 weeks in the yellow range, the dial has returned to orange, indicating a high risk of COVID-19 spread. Since introducing the COVID-19 risk dial May 11th, this is the first time that the risk has increased. Please understand that this is an important signal that we must get more committed to our efforts to fight this virus. It's not only important, it's urgent. Our status as a community is a lot worse now than it was a week ago. Health Director Pat Lopez will outline the reasons for the increased risk and the clear reversal of progress in a few moments. Before she does, though, just let's consider a couple of data points. From Sunday, June 28th, through Saturday, July 4th, 170 new cases were reported in our community. That's the highest weekly total since the week ending May 23rd. Since June 22nd, when restrictions were eased, 75% of all cases have been individuals under the age of 40. So here's the deal. If we want schools to open this fall, if we want businesses to resume their operations, if we want to watch Husker football and volleyball and other fall sports, we have to make it happen. We have to practice those 3 W's we've been talking about. Wash your hands frequently. Wear a face mask. Watch your distance. Keep 6 feet between yourself and others. Today, an additional 30 individuals in our community have tested positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 2,028. Our total recoveries identified to date is up from 714 to 740. Director Lopez will now give us an update on all the indicators and explain more about why the position of the risk dial was moved to orange.
Thank you, Mayor. When we first introduced the COVID-19 risk dial in May, we started at the orange level, indicating a high risk of the virus spreading. At that time, we were averaging about 40 cases a day. 3 weeks later, we moved the dial into yellow, indicating a moderate risk because all of the main indicators were moving in the right direction. Today, some of our main indicators continue to be level, but over the past 2 weeks, we have become increasingly concerned with the number of new cases, the positivity rate, and the delay in getting testing results, which reduces our ability to do effective contact tracing. First, let's look at the number of COVID-19 cases. When averaged over a 7-day period, the trend shows a definite increase in cases. As the mayor mentioned, we had 170 cases reported in the week ending July 4th. From July 5th through today, we now have 167 lab-confirmed cases. We expect to end the week with the highest number of cases per week since late May. We are especially concerned that the vast majority of new cases are due to broad spread in our community. They are not due to a large cluster of cases from an event or a workplace exposure. With the easing of restrictions, we continue to see an alarming increase in the number of new cases being reported for those under age 40. As the mayor shared, 70% of all cases reported since June 22nd are under the age of 40. and 57% of these cases are individuals between the ages of 20 and 39. The second indicator is the positivity rate, the percentage of all tests that are positive. After remaining fairly steady for several weeks, the weekly positivity rate has increased the last 2 weeks, up to 7% last week and to 7.5% so far this week. This is a concerning trend, and again, these are levels not seen since late May. This trend is slowly affecting the overall positivity rate, which went up again today to 6.6%. Another factor we consider is our testing capacity and availability. This indicator has remained steady with a consistent average of about 2,500 tests completed over the past 6 weeks. A total of 30,911 individual Lancaster County residents have now been tested. Some people may have been tested more than once, but this is an unduplicated number. Again, we have the availability and capacity to do more testing, so we continue to encourage people to sign up to get tested. You can start by contacting your doctor or by filling out an online risk assessment at chihealth.com or bryanhealth.com to get an appointment for a drive-through test. Test Nebraska continues to offer COVID-19 testing to all Lancaster County residents, even those with no symptoms. Test Nebraska will be available in Lincoln next week on Wednesday, July 15th, and Thursday, July 16th at North Star High School. The hours are 8 a.m. to noon and 1 p.m. to 5. This testing is also done by appointment only. You can begin the process with a free online risk assessment at testnebraska.com. While the availability of testing remains good, we have some significant delays in reporting test results from commercial laboratories that are analyzing many of our local tests. This slows down our efforts to initiate the contact tracing process. And this brings us to our fourth indicator, the capacity of the health department to conduct investigations and contact tracing. The health department currently has 34 contact tracers available to conduct these investigations. With a full caseload, this would be enough to investigate up to 120 new cases within 24 hours. This capacity is more than sufficient at this time and has kept pace with demand. But again, we are concerned with the recent turnaround times from lab testing to 5 to 7 days in many cases. Contact tracing is initiated with all positive cases within 24 hours of receiving the lab results. The nurses check on patients' welfare and take a full history of where the individual has been and who he or she may have interacted with while symptomatic and in the 2 days prior, when the transmission is also possible. The nurses can help refer individuals to services that will help with cleaning, supplies, and food. The nurses also help contact employers to provide guidance on how to mitigate further spread in the workplace. Slow turnaround times from labs causes delays in starting the crucial process of contact tracing, which prevents further outbreaks. The fifth major indicator we consider is the capacity of our hospitals and our entire health system. To determine this, we look at the total number of patients hospitalized, the number that are COVID-19 positive, and the availability of the ICU beds. While the number of COVID-19 patients hospitalized today are manageable, we are concerned that the number has begun to increase as well. Last Friday, we had 9 COVID-19 patients hospitalized. Today, we have 15 COVID-19 patients hospitalized, with 8 from Lancaster County and 7 from other communities. We also have an additional 6 patients that are suspected COVID-19 cases with pending lab test results. With an increase in the number of overall cases, we can also anticipate an increase in the additional patients needing hospitalization over the next 2 weeks. We take all these indicators into account when deciding the position of the risk dial. And we are especially concerned about the fact that most of the cases are due to broad community spread rather than an identifiable cluster or clusters. The under age 40 group is contributing to this community spread in several ways. They may unknowingly have the virus and are spreading it at bars and in social gatherings. Young people also work in food service and healthcare industries, creating additional concerns that they will spread the disease to their coworkers, customers, and patients. Unfortunately, we are seeing new cases occurring because young people are taking the virus home, spreading it to their parents or other family members, and possibly to grandparents in some cases. This is why every single person in Lincoln and Lancaster County needs to be on their guard and reevaluate or take a step back to assess the seriousness of the situation we are in. The health department will continue to work with businesses and help them with preventative measures to keep services open. We will continue to work with schools on their plans to have students back in session this fall, but we want to stress we cannot move forward without the help of the public. At the orange level, the public guidelines include the following recommendations. Stay home as much as possible unless you have to travel for work, medical care, or food. Stay at least 6 feet away from others. Wear a cloth face covering when you're outside the home or around others. Continue to wash your hands frequently and disinfect highly touched surfaces. Before you go out in public, ask yourself these questions. Will I be in close proximity with people outside my household, and for how long? What is the size of the gathering, and how many people may I be in close contact with? What preventative measures can I take to reduce risk? Those at higher risk should certainly be more cautious than the young and otherwise healthy individuals, but they can get sick too. We should all act responsibly to avoid putting others in harm's way.
Thank you, Director Lopez. We cannot stress enough that this virus is not taking a summer vacation. This virus is happy to join you at the bar. This virus is happy to attend your birthday party or your family reunion. This virus is happy to give phase 3 the middle finger and reverse our progress if we let it. The virus is really getting a foothold in our community now. It is all over the place, and we have to take it seriously or we will suffer the consequences. Just this morning, my husband took his truck into the dealership to get serviced, and no one at the dealership was wearing a mask. I guess that dealership hasn't heard about the other car dealership in town that is closed right now because employees have come down with COVID-19. This is just one anecdote that illustrates how our economy and our health are intertwined. Our lives and our livelihoods are at stake. Is it really so much to ask to wear a mask? This virus embraces people in every political party, and people in every political party should embrace wearing masks. Senator Mitch McConnell wears masks. Senator Deb Fischer wears masks. I wear masks. Let's do the right thing together, Lincoln. Let's flatten this rising curve. And I want to add a few more questions to those that Director Lopez just listed. Before you go out and about, ask yourselves these questions. Is this trip necessary? How would I feel if my actions led to someone close to me getting COVID-19? Think of your spouse, your children, your siblings, your parents, especially your grandparents, your best friend, and your coworkers. Is going out worth the risk to my health and the health of others that I care about? Many people have sacrificed a great deal to protect our community, and they have made these sacrifices with the big picture and the long term in mind. Please, let's not let those sacrifices be in vain. Honor them by taking personal responsibility. Take the precautions that put all of us on the quickest route to greater recovery that benefits everyone in our community. We must take responsibility to contribute to the change that we want to see. If we want to see schools back in session this fall, if we want to see Husker football and volleyball and other sports this fall, If we want businesses to remain open, then we all must do our part. Please, let's work together to control this virus so this virus does not control us. Stay at home as much as possible and limit your interactions with others outside your household. Stay at least 6 feet away from others. Wear a face mask every time you're outside the home and around others, and continue to wash your hands frequently. Finally, please consider getting tested. In many communities, we are seeing long lines for testing. Here in Lincoln, testing is available for anyone, even if you have no symptoms. Again, just visit testnebraska.com to schedule an appointment. Next, we are turning to the topic of unemployment and reemployment. On Tuesday, the Nebraska Department of Labor announced that people receiving unemployment benefits must start looking for a job next week in order to continue receiving those benefits. Previously, the guidance was that people had to resume their job search on August 1st. If people do not engage in a certain amount of and a certain type of reemployment activities per week, starting next week, they could lose both federal and state unemployment benefits. This includes the extra $600 per week in federal aid that was scheduled to end the week of July 25th. For more information about this change in Nebraska policy, please visit the Resident Resources tab of our website, covid19.lincoln.ne.gov. Fortunately, we have several resources in our community to assist those seeking reemployment. For one, the city is excited to support another drive-through career fair. The next drive-through career fair will take place on Tuesday, July 14th from 10 a.m. to 2 p.m. at 3 different locations: Gateway Mall, Northeast High School, and F Street Church. People who drive through one of these locations will be handed a packet of materials with job information, all while remaining seated safely in their vehicles. Over 50 local employers are participating, representing sectors ranging from healthcare to manufacturing to customer service, and we encourage anyone who's looking for reemployment opportunities to attend this event, especially those who may be receiving unemployment benefits. Importantly, the drive-through career fair counts as a reemployment activity. Other types of reemployment activities include applying for jobs through neworks.nebraska.gov, attending a job skills class, and meeting with a job coach or career counselor. You can meet with job coaches and get job search assistance at the American Job Center, located at the SCC building at 1111 O Street on the 3rd floor. For more information about reemployment activities, the drive-through career fair, and the American Job Center, check out the Resident Resources page of our website, covid19.lincoln.ne.gov. A bit of positive news today. I want to share an example of how the business of city government goes on despite the pandemic. One of the most important and useful documents for our community is the City County Comprehensive Plan. It lays out a community vision and provides the city with a guide for the next 30 years in the areas of land use and economic development, housing, transportation, health, and sustainability. Every 10 years, the planning team works with the community to update this plan, and that update is now underway. We are calling it Plan Forward 2050. In February, we had a successful kickoff event at the Pinnacle Bank Arena with an open house and interactive exhibits. It was probably one of the last in-person public events that we hosted before COVID-19 ushered in the concept of social distancing. The good news is that the second event is underway now. At lincoln.ne.gov, keyword 2050, you'll be able to participate in a virtual event and take a survey. The virtual event features 3 scenarios for growth of our community and a mix of interactive content and information. You'll have until the end of August to share your thoughts about the future of our community. How we grow impacts how we allocate city resources and services, the investment of private funds, housing, and all the factors that create a high quality of life here in Lincoln. I want to thank our planning department for making this virtual event possible. Please let your voice be heard at lincoln.ne.gov, typing in keyword 2050. Finally, today, we wanted to end by sharing a photo that demonstrates city leaders committed to fighting COVID-19. At a news conference on the budget this morning, 5 city council members joined me in helping to spread the word that wearing masks and keeping your distance from others are proven weapons against this virus. Our city, state, and nation are at a critical point. What each of us does right now will have a direct impact on our future. Let's learn from what is happening across the country and other cities and states and refocus on flattening the curve here at home. Stay home as much as possible. Keep your distance from others and be a hero. Wear a mask whenever you are out with other people as a sign of respect, care, and consideration for others. And with that, we'll open it up for questions.
Mayor, this is Bill with 1011.
Hi, Bill.
Yeah, would there ever be a chance of reversing course and moving out of phase 3 and back into phase 2, or does the county have the authority to do that?
You know, we are, of course, looking at these numbers and assessing all of our options. We want to continue on the path of progress, but really it's going to depend on our community members taking those important steps. We want people to wash their hands, to wear masks, and to keep that physical distance. No measure is effective without the compliance and cooperation and commitment of our people.
So would the county have the authority to make that change, or would that have to be done at the state level if it were to get to that?
You know, the health director has broad authority in an emergency situation like this pandemic. So we will be evaluating all of our options, and we don't have any to report today that we are enacting.
I have a question for Pat as well.
Okay.
Good afternoon, Bill.
Good afternoon, Pat. Are you able to say how many of those hospitalizations are in that younger age group?
You know, I'm not able to say. That's one thing. I don't have that information available right here. But I can check into that, Bill.
Okay, question from Margaret Reese at the Journal Star. What are physical distancing recommendations in schools? Has that changed or been modified as you've learned more about transmission?
We haven't changed our recommendations for physical distancing, and we're working closely with the schools to adjust in the environments they're in to do it as safely as possible. One of the things that is happening with the schools is our public schools are recommending face coverings, and we'll continue to work with them and provide more information on that for Margaret as we get closer to the time of school opening up.
Hi,
Sophia Starrick with the Journal Star. I was wondering if you're considering mandating that people in Lincoln wear masks in public as cases are spiking around the country.
You know, we're closely monitoring what's happening in other parts of the country and what actions are being taken to control the spread. And I will say, you know, that's why today we're really focusing on, we really need people, it's up to all of us to take this very seriously, be responsible, and wear face coverings when we go out, and social distance or physical distance is more appropriate, and do the hand washing. We often are asked about mandating face coverings, and that is not something at this point. It's definitely something that's there, and we're continuously evaluating.
okay, thank you.
Mhm.
Bill, just to follow up on your question about hospitalizations, while it's less likely that people in this younger age group end up in the hospital, the point we're trying to make today is that as the number of young people spikes, number of young people who have been diagnosed with COVID-19 spikes, they often are more likely to be asymptomatic carriers and therefore more likely to contribute to community spread. So while they may not end up in the hospital, they may land a lot of other people in the hospital. They may bring this home, they may bring it home to older parents, they may take it to their grandparents unwittingly, unknowingly, inadvertently. So we are very concerned right now about what these trends mean for our community. And we're asking everyone to recognize how urgent this situation is and that we all have a role to play in helping to prevent these spikes from continuing. Any other questions? All right, well, thank you so much for tuning into this briefing. Please take care of one another and be a hero. Wear a mask, keep your distance from others, and stay safe. Thank you.